morning, good morning. How is everyone this morning? I hope you are all doing well. I hope you had a great weekend. I hope that those of you that are working on your health issues dig in this week and really tear it up. We talked to a gentleman here a few minutes ago, huge tumor on his back. It's going down and down and down. He's doing a lot of different fasts and stuff. So I wanted to go over some eyes. So I've got Drew in here to help us today. We are the Blue Man Group, right? Mm-hmm. Yeah, I got blue, you got blue. Come on, we got Blue Man. We're the Blue Man Group.
Blue Man Group.
We're the Blue Man Group. See?
Hey, how you doing?
The Blue Man Group. In fact, everybody
you look good though today.
Really
sharp colors.
Isn't that wild? Everybody wore. Yeah.
Just so everybody knows out there, I like very bright colors, just like you do.
Yeah. Heck yeah.
Because it gets you in a better mood.
Does, but the blue. You know, spiritual master one time of Eckankar was went and met the Hopi elders. And in the Hopi religions, the master comes to the Chela as the blue light or the blue star. And as soon as the Hopi elder looked at Darwin, which was the living Eckmaster at the time, he said, "That's him." And gave Eckankar like 100 acres in Sedona, Arizona for a healing retreat. That was pretty cool.
Wow.
Yeah.
I'm going to look that up.
Yeah. Now, we're going to go over eyes here. And someone wrote this to me, and I thought this was interesting. And this is what you're going to find. There's no question about this, guys. So, you know what? And this is from Parker. And you're going to find this in the world. And all I can tell you is that we each have to find our way when we understand some basic stuff. So I'm just trying to give everybody a basic understanding of how everything works, not an intellectual understanding, because remember, at a certain point we move out of the realm of knowingness into the realm of theories. And the mind isn't the realm to find your happiness with. If you notice, your thoughts and your emotions will never find you happiness, because there's always a plus factor. There's always something different, something this, something that. There's always changes. Everything's in flux. The only stability you have is yourself. It's the only stability you have, and you must find that self, that true self, not the thinker, not the thinker of the thinker of the thoughts maybe, but not the thoughts, the emotions. So you have to take some time and really get a hold, especially those of you that are suffering so bad, especially with mental and emotional issues there. I feel for you. But remember, the endocrine glands are a big thing. I just finished I shouldn't tell them, right? Well, come on. I created 4 new formulas over the weekend because we really need them, and especially blood sugar. So I'm going to give bitter melon a big try, and we came out with a blood sugar control formula. Now it's just getting it to you, and this should be a heavy hitter in terms of blood sugar control. And then I got a pancreatic formula, which is more specific for the pancreas. Having one formula, I had to split the two so we have less power for each side. Now, Parker's talking about research online about central heterochromia. Looking through many iridology sites and iridologists, and even some on Dr. Bernard Jensen's work, many of them would have different opinions on what was the cause of orange around the pupil. And this is true. This is very true. One site claimed it was a liver pancreatic disturbance. I saw that one. Like, a liver pancreatic disturbance is going to give you a friggin' orange around your eye. That's stupid. I mean, when you understand the lymph system, when you look at the orange, you know that it is involved in the lymph system. That's where it's at. And you know that it's not a part of the anatomy of the body because it is in the lymph system, and you can see that it is movable. You can eliminate it. You can move it. You can thin it out. So you know it deals with a substance that is not a part of the physiology, part of the structure of the human body whatsoever. It doesn't match up with any weaknesses too, because we're looking at the lacunas, the crypts, and all of that. So we know that it has nothing to do with the actual weakness of a tissue at all. This is something that's been ingested, and you see a lot of chemicals in the human body. Now, we don't always know what they are, but we can see certain colors like reddish browns and oranges. Some you can tell it's iodine, some you can tell it's sulfur. It's just that I put a lot of attention on this one. And I've done a lot of personal research with the sulfurs, and it just makes total sense. And when you start applying it and you start seeing that people have the sulfurs, and the sulfurs come out. They smell like sulfur, it comes out your stool, it comes out your urine. This orange comes out. So we know that it's an ingested symptom. So what else is it? It is sulfur for sure. I can just tell you it's sulfur. We've done years of this. This isn't something I just can't. This has been something we've looked at for years. With the sulfurs come the heavy candidas, etc., etc., etc. And I'm going to show you one here, first off, of sulfur and how long they've had it in there and what's happened, how the body is trying to get rid of it. Let me go on here. Lack of enzymes causes orange in the eye. Give me a friggin' break. I mean, there are some real stupid opinions out there. No offense, but it's time man pulls himself out of this kind of stuff. Chronic stomach ailment. Chronic stomach ailment creates orange in the eye? No, it doesn't. It creates black in the stomach where you have serious stomach problems. Now, you could have orange in the stomach area, which could irritate the stomach, but this question needs to be reversed. Chronic stomach ailment. Well, what would cause a chronic stomach ailment? You got a couple of choices. One is deterioration of the cells. That's going to turn black around that. Orange is going to have sulfur, which is an irritant, causes IBS all the time, or like an acid reflux, gas, bloating, things like that. So what we're doing is we're trying to blame orange on an ailment when we should blame the orange for causing the stomach problems. Dirty blood, drug deposits, which is true. Drug deposits. This is considered a drug, even though it's a gas that settled in the intestines and so on and so on. Sulfur, guys, you'll be ahead of the pack. I'm bringing you guys ahead of the pack. Dr. Jensen and I were good friends, talked a lot about these things. There was even a doctor who had before and after pictures of a young lady's eyes with orange all around the pupil. He said it was waste in the intestines, colon, and blood. Well, it is kind of a waste, kind of a way. I mean, he's kind of right. And he put her on a plane, da-da-da-da-da. Basically stabilized electrolytes of oxygen and pure ascorbic acid, and he claimed in 5 weeks the orange was virtually gone after pushing this plan. Well, he detoxed it out of the body. It's good if you can get heavy orange in 5 weeks out of the body. That's pretty good, but he was using oxygen and all kinds of things. Who knows, though, maybe she didn't have sulfur issues. This I can just tell you, for me, even a study done online that candida could be the cause of a central heterochromia, but they couldn't make a solid conclusion. If you read the article, they said a lot of people who had it also had an adrenal lacuna. Maybe that's just me, but wouldn't it be strange if there was some sort of connection there? I was thinking about the product Sparga and what they said about lacking the enzymes, which was due to genetics. I don't know what to say, guys. I can just say that to me, this is, I just don't go with the route of German iridology and this whole thing about the eye colors and all this kind of stuff. I don't play that sort of thinking whatsoever. I don't. This is how I teach iridology and just how it is. I've always thought some of these people are way out there. When you start looking at iridology from Jensen, and then you start looking at all the other there's some goofy people out there. There are some goofy iridologists, which has kind of hurt the iridology field because it has no respect. And this is what I was telling you about our field. We must build respect. We must become one in alliance. The problem is some of us are out here discovering things and working with things that we don't tell people. It's like the whole thing with Dr. Jensen wanting me to take his practice. No way. But now look what happened. It's with his daughter-in-law, which he couldn't really take her at all. I mean, I can tell you I spent years with Jensen, so I know the whole scoop of his family and everything else. So I know how he feels about these people that ended up with his stuff. Art, his son, and his son's wife, Ellen, which you know. Well, no, I made sense, Parker. I'll spend more time looking back and just tell you that I feel this is totally sulfur issues. Matter of fact, let's do a sulfur look here. Let's come around. I'm going to come around and we're going to go over some eyes, although slow up because we have so many questions. And the whole idea of me doing this is to help you guys learn how to read your own eyes. See, because there's no way I could possibly read thousands of eyes. But if I teach you how to read your own eyes, then you've got that knowledge stuck with you the rest of your life. And you can help yourself. You can help your friends. You can go, look, especially you nurses. You'll be able to see things your medical doctor won't even know. So it's really a good idea to learn iridology. It's so simple. And some of the stuff that's kind of iffy, just let it pass. Keep things simple always. They try to make things too hard, and they try to get into disease thinking. And you're trying to apply iridology to diseases, and you got to get away from that kind of thinking because it doesn't fit in that as it does as naturopathy doesn't fit in the world of diseases. Only treatment-based thinking thinks in the world of diseases, and treatment-based thinking never cures. It can make people feel better if it's the right type of treatment-based thinking, but would that be according to Honey Bobo? You didn't see that. I bet you didn't see that.
No.
I had to laugh because I'm from that sort of place. I mean, you just drive out in the woods and you're at Honey Bobo's house at my place. Where I'm from in Indiana, she's from Georgia.
That's awesome. Good for you.
Honey Bobo. Cute as a button, little girl, but pretty back there. All right. This is from Clementine. Oh, my darling Clementine. It's probably too old for you to remember that. All right, let's do her right eye here first. Now, she's a Dan McDonald viewer. She owns a tropical fruit farm in Southern California. I love this lady already. Holy crap. Tropical fruit farm. I mean, it's just so unbelievable how bad we have it around here in terms of food. But this is Clementine. She is, it's got an incredible tropical fruit farm, I hear. Oh, I'm hitting it. Oh, jeez. Oh, yeah. Let me see here. The farm, you can order from her farm. Says about the ice. Okay. All right, Clementine, let's take a look at you, sweetheart. What do we have all around here? Orange, orange, orange. Now, this could be a heterochromia, or it could be all kinds of things, right? Yeah. All this thick white, sweetheart, all that thick white is your lymph system. And see how this orange is embedded and flows with that lymph system? And this is the collarate around the pupil. And see how thick that is? And there's your malabsorption ring, sweetheart, right around that. Get a little haze in this pupil, so I hope that's just the light. Too much haze there would be an indication of a cataract coming, which would actually be cholesterol. Now, you notice how this orange is taking out toward the outer scurf rim or the outer rim of the eye. This really doesn't have much of a scurf rim, which is good. That's a skin ring. But here's the lymph nodes. All this thick mass is lymph nodes. And it's real close to the subcutaneous tissues of the skin. So that backs up along with the lymph nodes. You can see she's had this sulfur most of her life. She still has it in the stomach pretty good here. And you see some darkness in the stomach in places. So that stomach of hers probably did cause her some problems here at a little time here. Now here's the hepatic, meaning liver, hepatic flexure, which is sagging down. This should come up a little bit. It's sagging down. Typical with the flexures to fold or to drop when you lose connective tissue integrity. Kind of peeking over here at the parathyroid, we have a little bit of an area here that would be suggestive of parathyroid. And right at that collarate, another little bitty area could be considered a parathyroid. Looking at the thyroid, pretty thick with lymph though. Pretty thick with lymph. Tonsil's not very happy if you still have that, but here's your throat as well. And that's a throat heading for a sore throat. This is your back. You got a lot of lymph in the back. It's just not filtering through this kidney. Now notice how you're getting dark right in this area. This is your kidney and adrenal area, your vaginal, and then your bladder. And see, you've got some bladder. See how that white is built up around these two lacunas. See that thick white? That means that lymph, and that correlates perfectly with Dr. Jensen's theory, is that these genetic areas are compromised at blood and lymph flow. And it's interesting that happens. And if you really think about this, this is how it became a weakness in the first place, is from the lymph. So it all fits hand in hand in hand. People don't have to live and breathe it and have breakfast over it all the time. Now, this is the groin. This is the appendix. I don't think the appendix is real happy here in this part of the right hip. Yeah. Right here, we're at a pancreatic and a right ovarian weakness. This is going to be a right breast weakness and chest wall weakness right here. And this is going to be that right shoulder, or pretty close to that right shoulder up there, getting close to an ear. And look at this medulla. I mean the cerebellum. That's all the equilibrium center. So that right up there is getting into the brain. We don't know what's up in here, but we see a couple of little things in the brain. The sinuses are congested. This is the pituitary right here, so we have a little pituitary, little bit of prolapsing going on. So I take it your parathyroid could definitely use a little kick in the butt there, dear. But not too bad. I mean, really the lymph system is the big deal here, and all the sulfur and stuff. And you can always tell in clinical practice is where you learn the most, not in books and not in people's theories, in clinical practice. When you see people like this, they're always heavy candidated people, unfortunately. Feel for them, but that's what sulfur does. And you can go back, and women can identify that with having an antibiotic at a medical doctor's office, getting a yeast infection from it. You know, you can always see where sulfur drugs spawn candida problems. And really, when you correlate it in your practice, you'll see this. This is your left eye, dear. This is your upper spine up here, upper C spine. It looks like you have a little problem in your C spine, maybe upper T's as well. Hard to say here. Now, right there, big time parathyroid, thyroid. That's a pretty good parathyroid weakness. So we're talking about glandulars this morning, and that might be a case where a glandular would be effective, where you have a pretty dark area where that left lobe of your thyroid is just not functioning like it should. There's no way that lobe is functioning well there. Pretty dark, pretty involved. Your whole bowel area needs to be revitalized. Seeing more prolapsus as you go along here, but revitalize that bowel. Get that stomach, because we see more stomach problems and irritation from the sulfur. Then we see the malabsorption from the collarate here, and a little bit of, maybe a little bit of pocketed areas in the bowel. But good, strong genes, I like that. Here's a left leg weakness, a left groin weakness there a little bit. But really, you've got good genes here. This is going to be the bronchial trunk and the lungs over here, starting to pick up some weaknesses in this area. But not bad. Not bad, dear. Hope that's helpful. Now, Bev. This is Beverly. Let's do the right side first, of course. Now, and same with this. This is very easy to tell. Can we get that one? Mm-hmm. What color of eye that is. That's blue, no question. So then what color are we looking at here? Can you get that in there, Mike?
Perfect.
How about that? That's better. Well, this is a blue eye. Looks pretty green. And then we have the typical brown around the pupil, which is the GI tract. So here's a case where you have a chronic GI tract. You don't see a lot of weaknesses in the gut, but definitely chronic lymphatic. Look at this big black area here. Very difficult to tell if this is some type of chemical that you've ingested. It looks like it's sitting on top there. Could be a genetic weakness in that area. Could be, there's a lot of could-bes. It would be nice to see if this individual, this is Bev, that this lady had that all the way in her life. This is in the upper neck area, upper C and T spine area. Maybe even getting some throat picking up with this. Either a toxic chemical settled in that area, which what it looks like to me. And it could be a genetic, I don't even know why they call them these, but some of these spots that are genetic spots like that. with that said, you see how this brown is radiating up in the brain a little bit? So the sinuses are chronic and we're getting a lot of lymph up in here. Notice these nerve rings. There's a lot of nerve rings here in this person. And when we go right here, we see the chronic adrenal gland and kidney right here. See that darkness? Mm-hmm. And then this is going to be the female vaginal area and uterus. So this person needs to douche and do that way. Could encroach the bladder there a little bit. This is just a little bit of groin and then hip on the right side, and then you get a lot of lymph in the pancreatic ovarian, right ovarian area. Little gallbladder up here. But good strong genes, got to get those adrenals turned back on and get this bowel cleaned up. See how dark you are around the bowel. And the pupil's a little small. It's a lot of stress in this person's life probably. Or inside the body.
This camera really catches the detail.
Does it?
More than what it shows on the physical.
Wow.
If you look at this.
Wow.
See?
Oh, I love
it's
that.
Clear. You see the nerve rings?
Oh, I love that. I love that. Well, see that if I took a bright light and shined it on that, it would pull it right up out of there. Right. That's another thing. If you have pictures and you're hard to read them like brown eyes, get you a high-powered light and it'll actually pull them up out of this. Some of the same stuff. I mean, you got good genes here, but, chronicness of bowels can't be underlooked here. Very chronic bowels, gut, stomach, whole 9 yards. Moving into the sinus, here's a little bit in the frontal lobe here, building up in the cerebellum, which is the equilibrium. So this is just a lot of lymph. This is a blue eye looking green, brown, hazel, basically. And that is a blue eye. That's a lot of work to undo that, But getting into that chronic bowel area, the kidneys, this is more the female, I think, area again. This would be the lower back, which would pick up the kidneys. Maybe a little femur, groin. But so just really needs to clean the body up here. Hope that helps you, Bev, sweetheart. Let me see here. She has a thyroid lesion of undetermined cause.
Great photos.
Could we say acids? Mm-hmm. That's an undetermined. Acids are undetermined causes. That's what I think. When you take a look at your thyroid here, it's really not bad.
Let me zoom out.
Can I set that on top?
Mm-hmm.
I don't think it's going to do it. How about that? Thyroid. This is the left part of the thyroid, the left lobe, which is a little weak right there. And that might be the side. The right side just has some congestion, particularly in the parathyroid. But your pituitary is a little bit chronic, and I would say that the pituitary influence on this thyroid would be obvious. So it could be if you're having that, and you're having a, what is it now? Let me see, thyroid lesion that measures about 1 centimeter in length. Yeah, you're just getting chewed up by acids, dear. So you want to turn that around and get that lymph moving, and then you will eliminate that lesion there. Let's do the right side. This is his right side. Oh no, this is Dee Dee, so this is a female. Not too many men wear mascara.
Great photos, though.
I love them.
Great
Yeah,
photos.
I mean these guys are coming up with some pretty dang good photos. I mean, considering. Sorry about that, guys. All right, now this is Dee Dee. Thank you, Dee Dee, for your comments here. She's on Hill-LT. She's on the adrenal, lymphatic 1, kidney, and bladder 1 for 4 months. And just switched to lymphatic 4 and kidney and bladder 2, and I'm taking Parasite M. It's about 90% raw, sometimes 100%. Pretty damn good. I mean, pretty darn good. This is Monday. Just recently did a 2-week melon detox and went off a week. I then got a massive kidney infection and ended up in the emergency room. Now, this is very important to talk about. Very important to talk about because she was pulling too much lymph into her kidneys, and her kidneys are already lymphatic up. Let's take a look at that. This is her right kidney right here. thick with lymph. So that kidney's already itself backed up with lymph. This is when you're going to see the creatinine start going up in people, is when the lymph system starts overtaking the kidney itself. That's when you start seeing problems with the kidneys that's deeper than filtration problems. That's when the kidney itself starts going down. Till then, the adrenals are controlling that. And you see this. This is the, if this is a female, this is the vaginal wall here. And maybe encroaching a lot of lymph in the bladder. So a little douching with some Heal-All tea would be appropriate there to strengthen that. But don't go to the ER. When you have massive kidney infection, here's what you do. Take a kidney #1 formula or #2, and you'll take that on the hour, every hour, or a dropper full every 2 hours. And then you can take one lymphatic formula, but we'd only advise one lymphatic formula. But you would definitely hit the kidney formulas, and you could do the lymphatic formula every other dosage on the kidney formula, and then pound the melon. What you did with the watermelon was just broke your lymph system loose, which is real cool. But what's this person facing here? What's Dee Dee facing? Look at the sulfur. Look at the orange. Now, orange isn't a color of any real toxicity that's ever known in iridology. You only have your whites and your off-whites and your greens and your browns. You have orange is not a color of a level of toxicity. Orange is toxicity itself, which is sulfa drug. I can just tell you, I've done too much looking at this, and I don't really care what the other books say, tell you the truth. No, I don't care what other iridologists say. Some of them are nuts. Some of them tell people they see cancer in the eye. If an iridologist does that, that's what gives us bad names. And gets their butt in trouble. This person has a very heavy lymphatic problem, and this is why she went into a UTI that quick. And it's sulfur, so she had a lot of fungus hit her too. And this is also, she does have a skin ring, a scurf ring, and right under her skin you have the epidermis, the dermis, and then the subcutaneous. That's thick with lymph. This person is like a time bomb of lymph wanting to explode out. It doesn't surprise me at all she had a UTI. And there's a bit of a kidney weakness sitting on top of that baby. So you just want to be careful, adrenals. Just move your lymph, sweetheart. You got good strong cells here. Bowel's not so here. This is the transverse colon. This is the part that goes across the belly, so to speak, the abdomen. See how dark it is? Even in the stomach there, you've got some burns on the stomach wall right at the stomach area. So you got to heal that up. Stay away from protein. This is on the transverse colon part. This is picking up your pituitary and pineal, by the way. So I don't know if you sleep well, but this is a person that has extreme acidosis, high candida, high fungus problems, of course, which is the candida. Lymph. Skin isn't filtering for her well. The kidneys aren't filtering for her well. So it does not surprise me one bit that she came down with a UTI. She didn't come down with it. She started moving stuff through her kidneys faster than the kidney says, what's all this stuff? Now, nerve rings, you don't have a lot of them, but you have a few, and of course that's the autonomic there. This is her left side. Eyes are funny. It's like the person's looking right at you. Isn't it funny? This is more of the same. This is lymph. Now look at those bowels are really pushed way out here, which is kind of interesting. Could just be a light. Some nerve rings here, but again, we're more stomach and more transverse colon and the upper portion of the descending portion of the colon. This is the splenic flexure and the upper portion of the descending colon down toward the sigmoid flexure. You have a couple little, and this might indicate a little prolapsus or spastic condition at the lower end of the. We should show some pictures of colons because nobody has a healthy colon. I mean, I hate to say that, but it's just almost a fact. You would have to be an islander raised totally away from all meats.
Isn't it very rare that you've seen a perfect or a healthy colon?
I personally, of course, I don't get to see them outside of the body or where you're, but I knew surgeons that have never seen them. So if you're a surgeon and you've worked in the body a lot and you've never seen a healthy colon, that kind of fits right in with what's going on out there. And this is one of them that needs to get their bowels really cleaned up because you're real thick here. I can't see much of a malabsorption ring. There is one there. But I can say that you're not absorbing your foods. You've got a lot of lymph toxicity. You got to clean up that bowel. With that said, got to get your sinuses drained and get this sulfur to come out of you. You're saturated with it. Now, if this is too light a setting, this can be brown, looks like orange. So you got to realize that too, that this setting could be too light because look how light her skin is. There's too much light in here. That could make this orange. This could be brown, appearing to be orange. You would have to really look at her in a normal setting of light here to see if that is really orange. If not, it's still tied in with chronic lymph, meaning this lymph system hasn't the ability to clean it out of the body. And so real important. You've got good genes, dear one, but lots of lymph. This is the upper neck area here.
So it's not a blue eye? You can rule that out?
Well, now that's an interesting question, my dear man. What color eyes does this lady have? I just cannot feel good calling it a brown. Look at this. It could be brown. If you have brown eyes, sweetheart, it's real light brown, but I wouldn't call it. It's too early to tell. I would definitely detox this young woman and see where we are in that sort of thing. Okay, thank you, Dee Dee. Hope that helped you, dear one. Now, I'm going to put the right eye up first. I'm going to show you the value of proper colors in taking it. You can tell by the skin tone we're way off color here with the picture on this one. But on the what's going on out there?
They're having a good time.
They are having a good time. Can we scoot this over? How about if I scoot this?
There we go.
Can you pick that up? Now, look at the left eye and the color of the skin and a more defined color of the pupil. And you still are not quite sure, but you could safely say this is a blue eye. Safely say this is a blue eye, no matter what the armature, how you've got the light setting. Now, bit of the same. We've got chronic, almost brown. See that brown developing around the pupil? That's chronic lymph. And so we do have places along the bowel wall, all these little places that reach out and affect the related tissue. So let's say this is the left eye. So let's say this is the medulla, the left ear, and the left shoulder. You can see where the bowel has a weakness right up that medulla line or that cerebellum line, which can give equilibrium, dizzy, vertigo, that sort of thing. Lightheadedness. This is the pituitary right here, left side. And then you're getting back down here, the pineal gland, which is the gland of rest, but you're up in the brain. And see how these are becoming radius solaris. They're radiating up like this, up the fibers. Back over here, let me see here. We got that. Well, we're probably pancreatic right there, and that's a pretty good pancreatic weakness. Started on the bowel, so that's why we always clean up the gut. No matter what we do, we're always cleaning up the gut. We're always cleaning up the glands, and we're always cleaning up the kidneys. Therefore, you're majorly hitting the body in 90% of its vital areas. But again, the bowel needs to be affected. But this is a pancreatic weakness. How it affects your digestion or your neutralization of hydrochloric acid, whatever. Now, we're coming in here with a little bit of hip and groin weakness. This is a big groin weakness here on the left. No, I'm sorry. I'm on the left eye. Forgive me. I'm sorry. I keep thinking right, left. So let me go back. I apologize. This is the left leg. A lot of lymph in that left leg. See how thick that is? So that left leg is not moving through, and don't you wish it was the other? This is the left kidney. Ugh. See how big that left kidney weakness is? That's a real important issue to work on that left kidney. But notice it comes with a blue eye that's becoming chronic. So this would be a chronic kidney problem in adrenals. This is the upper femur. with a leg, a lot of inflammation, knee, all through that leg. And if you look at the hip, this is a genetic weakness in the hip. Kidney, probably a little rectal wall. Now this is this is the left eye, so I apologize. I want to go back. This is the lower back, which would go with the kidneys here. But really a strong eye here. This is upper chest wall, and then we're getting some bronchial weaknesses here and some congestion in the lungs. If I look over here, you see how this light pulled us away from really seeing this. You would almost think it's a brown eye if you looked at this eye. But it's more of the same on the right side. I think the right side is a better kidney on it, but I can't see. This isn't enough definition to this eye, but I can say that this looks like the kidney area there. This is the hip on the right side. This is the wrist or the arm on the right side, close to the lower rib cage though. So somewhere in the lower ribs, the right arm area. This is the right breast area, so there is a weakness in the right breast area. We're over here in the tonsil and a lot of lymph in the thyroid. This could actually be the thyroid here, and the tonsil's pushed up a little bit even. So you have to correlate a little bit here. Throat. So here's sore throats coming. Tonsils need to be cleaned out if you still have them. Thyroids, parathyroids enhanced. Little lower back, mid to lower back there. Now get this. This person suffers with schizophrenia, or was at least diagnosed with that. She's 29 years old. He's a health enthusiast, which is great. She spent a lot of time and money going to natural people, which I find disgusting, but then that's probably my own ego. But I tell you what, we need to get together, and that's why it's so important that you YouTubers and everybody work together, because we need to come to at least some important agreements and then let everything else be what it is. Now, her case, is this a her? What's the name? Doesn't give me a name. But that's okay. She was born, I'm going to call it a female with what I see up here in the eyelashes. So this is she's an alcoholic and smoking parent. 2 months premature. She had an eye infection, cold and swollen heel from blood sample taken soon after birth. Now, if you have a blood sample as an infant or a natal, and you're taking a blood sample out of a foot and it doesn't heal well, what immediately can you tell about that infant? What's the first thing you're going to know that this person's going to have trouble with? Kidney and adrenals in the lymph system. Kidney and adrenals in the lymph system. Well, what does the adrenals, what weakness does the adrenals build in the emotional compartment? And she goes on to say here, anxiety and panic attacks, more anxiety and panic attacks right here. She's born with weak adrenals. You see that here in the eye. And look at this left adrenal, very chronic. So yes, she would have that sort of thing going on. Emotional. Here is some parathyroid and thyroid. So yes, she could have some self-image things and maybe some problems with the depression there a little bit. But to label these mental things, I don't like the labels like that. Now get this, as we're going along, as she's growing, she has sinus cleaning operation. Immediately you know she has bowel problems, because when the sinuses back up and the head backs up, remember I keep relating it to the transverse bowel. What do you see in this case? Chronic bowels. Chronic bowels, and right up there's the sinus area. Sinus area. So, what you see here, just fitting the eye. It's just fitting the eye in what you see. But it's telling you that at birth, she had adrenal problems, which gave her the emotional problems that she has. This is her family that gave this to her. And so her family wants her to get on chemical medications on all this crap like that, and I think she needs to fix the adrenals. One tonsil removed. So immediately you know she's having lymphatic problems. These are lymph nodes. So she's having lymphatic problems since day one. Adrenal weakness since day one. But these are genetic weaknesses. Absolutely. and it's coming out of the family tree. A good thing here, dear, is you got good, strong genes, sweetheart. Get your body cleaned up and strengthened. Get those bowels cleaned up. It'll drain the sinuses. Get the kidneys filtering, the adrenals turned on, and you'll be good. Now, we're talking about the use of herbs and diet and things like that. I'm just covering what you need to do. We've covered plenty of times what you can take. She had ear infections.
Lymph.
Yep. Two amalgam fillings, hay fever, there you go, lymph, 2 right eardrum reconstruction surgeries. They failed. You see what's going on here in the ear. This is the left side, so up in the ear, there's your weakness in your left ear right there. And look how big that is.
There's a pattern.
There's a pattern right here, and then we get up in the ear right here, the right side. So easy to see that. More anxiety and panic attacks. Withdrawn and shy, overachiever. That's your adrenals, and that's a lack of love of yourself. Trying to prove a point. Wisdom teeth removed. Braces. There you go. Parathyroid. Structure's weak, which would fit in. Panic and more anxiety and panic attacks continue. We're going right up her line here. Bad digestion. Well, look at the stomach. Chronic stomach area here, of course. Binge eater, well, you could have a lot of parasites too, though. You start getting into these chronic bowels, you could pick up some wicked boys. OCD, burnout in all full-time jobs, jittery. Okay, so jittery. We know we got some, well, she doesn't got many nerve rings, but what do they love to give you in hospitals, vaccinations and things like this? She has amalgam filling, so she could have any suppression. Also autonomic. When I get up in the cerebellum, I've got some weaknesses in the cerebellum, which is the parasympathetic nervous system. So look at that. And then we have the adrenals with the sympathetic part. So both of the autonomics are down, or at least affected here. So real important to get that strong. Brain and nerve number 2 would be good to start working on the jitteries, get the sinuses cleaned out, get the pituitary up. That'll turn on the thyroids, get the adrenals up. Manic or very low. Again, going back to the thyroid and parathyroid again, and the loss of too much calcium. She's a spiritual path seeker, which she probably would be. Schizophrenia 06 to 09 on antipsychotics and 2 times electroconvulsive therapy. I was watching, I love that Dark Matters. It's a new TV program because I love the guy that hosts it because he's a biochemist on Fringe. He's the next Vincent Price. I can tell you, he's the next Vincent Price. You know, I love that guy. But it was showing Dr. Pasteur in his bullcrap theories, although it did show how he brought the rabies vaccine, and I will have to say that was a pretty good deal to bring home a rabies vaccine. The problem is we can do it with herbs, with the lymphatic herbs. They're all for those sort of things. You can do all that with herbs instead of all the shots in the stomach. Reading glasses, hit by car off a bike, but she's okay. Broke her helmet off, but she hit her right kidney. There's the kidney again. Now she had a cyst in the kidney. So here we go. We're going back to that kidney, back to that lymphatics. And I can tell you, looking at this left side, that kidney is saturated with lymph, very weak, etc., etc., etc. Cysts in breasts. We immediately going back to the lymph system again. Not moving lymph, dear one. Going back to your kidneys, and that's all. You don't have a lot of things going on. You got a good, strong body. Don't feel like you're weak, dear. You got a good, strong body. You got chronic bowel. Just clean this baby out. Clean this baby out. Kick up your endos, especially your adrenals. Get the kidneys cleaned out, and you'll be in good shape. Day 1 of period, excruciating pain, PMS, breast tenderness. That's all lymph. That's all hormones. Juice fasted out an inflamed gallbladder. If you have an inflamed gallbladder, guess what? Lymph. I have had enough of all the suffering. Yes, my dear, I can see that. And now you're on the path and the road to Wellville. And that's what you got to do. You got to work for Wellville. And all those parents out there that are down on their kids, or the opposite, remember, it takes time to walk to Wellville. That's all there is to it. So good job, you guys. I've got one more set of eyes I want to go over, and just not going to be able to get to all of your eyes because we have a lot of questions. This is going to be a little different the way we structure this.
I got it.
You got it?
Yeah. Of course.
This is Wendy and Rick. You're good, Drew. All right, this is Rick. Rick's left eye, Rick's right eye.
So I'll zoom into Rick's first.
Okay, let's do Rick.
Yeah.
Now, Rick, what color do you think your eye is? It was quite obvious. Blue eye, but what's all this white stuff? Look at all that white stuff. And look at the collarette. Look at that thick white rope around the collarette. Now, iridologists claim all kinds of things. This is the autonomic nerve breath. Is it really? This is the collarette that goes around the bow. This is the bow wall. If the bow wall is thickened with lymph, would it look like this? Absolutely. Absolutely. Now, let's do the left eye first. Got a knee going on here. Looks like a knee. A lot of lymph, at least in the upper femur here, because your bowels are kind of sagging down there on that leg a little bit. Look at that kidney and adrenal. Am I in the way? Look at that kidney and adrenal right there. That's a pretty good kidney and adrenal on the left eye here. A little bit of lower back from it. A lot of lymph. Just lymph, 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 lymph. That's probably a little, I tell you, this is, could be rectal, could be bladder. I'm not taking the time to measure these out because I just don't have the time, so I apologize with that.
Look at 9 o'clock. 9.
9.
See the
this
orange?
one?
Yeah, it has
that little orange spot right there.
Yes.
A little sulfur.
All right.
A little sulfur, but you see right here, this is the left eye. So this is the throat area. So he's going to be coughing up some orangey yellowish mucus and cleaning that out a little bit there, Drew. This is the tonsil. Was the tonsil, or if it is the tonsil, not real happy. But good genes, good nice genes here. Lots of lymph, stuff going on up here in the head area, but lots of lymph here. Here's a little genetic heart weakness right here. Just needs to strengthen that up, but you can't strengthen that heart up until you clean that lymph. See that lymph in the wall of the heart? That's what breeds cholesterol plaquing. That's what breeds heart attacks. Lymph. That's the causative factor right there. Already a weak heart from genetics, but strengthen that up, upper ribs there. No problem with that there. We look at your right eye here, more of the same with the collarette. It shows you the malabsorption ring. A little bit of stomach problems going on. See that darkness around the stomach there a little bit. So the stomach is not real happy. You just need to cool it down and let it heal up there with a little bit. Heal all tea, slippery elm, marshmallow, stomach and bowel formulas, etc., etc. Oh, we're at the ear area, real close to the ear here on the right. No, I'm sorry. I'm on the right eye. Ugh, okay, this is the tonsil on the right side. A lot of congestion here. Generally, I have the right on the left and the...
Yeah.
Yep. Had to throw the excuse in there, of course, you know. And a little bit of kidney, a lot more going on the left side, but on the right side here, not too bad here. This is the groin, the leg. Here's a knee right there on the right side. Again, a little hip, minor, but this is pancreatic and left and right testicle. This is coming in down on the hip, though. This bowel's expanded and coming down on the hip, and a lot of lymph just not filtering through that kidney. Excessive lymph in the bladder here. Now, looking at Wendy's, about the same eye. These two must live together. Even their eyes start looking alike, you know? Mm-hmm. Wendy's got a little more chemicals, I think, in the body here. Maybe tad sulfur, maybe something else, but that coloration could be subacute. Subacute turns the eye yellow, not orange, yellow, but that looks like some drug matter of some sort here in this eye. Looks like a little bit of dirtiness to the eye here, and a lot of lymph around. Same thing, heavy lymph, and this is the GI tract that needs some work. See over in this area here. Let's see, what eye is this one? This is right eye. This must be her right eye. Mm-hmm. It's hard to see up here. Okay, so if this is right eye here, there's your kidney and adrenals. This is upper femur to the knee. See how dark that is there? I don't like that darkness. When you see these deeper black areas in an eye, go after those areas. Groin. And then you get a lot of lymph in the hip, and you're in the pancreatic area. But now when I go to the gallbladder here, we need to do something with your gallbladder unless someone already has. Now this is if this is the right eye. We're up here again with the chest wall. And this would make this the right breast area. And on a woman, that's not, and a male too, that's not good. So you need to get that bowel cleaned up, drain that breast, get the kidneys filtering strengthen up that breast there. This is an ear, little. See how this is a little ballooning of the bow right here? See how that balloons up there and comes down to the bow collar it again? That's a bow pocketed area, but it's putting pressure on the ear. You might not have a thing wrong with the ear and have earaches from the bow. And that's the issue. And why we clean up the body head to toe, and why we're always getting into the gut, the GI tract, and why we're always getting into the kidney and adrenals. Man, if you never did anything but follow those things, you'd be doing so much for yourself, it's hard to explain. We get over here in her throat area. She's got throat things going on. Then when you see these throat things, you're going to have symptoms in detox, and that's going to be a sore throat. Here's also parathyroid and tonsil. So, Wendy, that parathyroid showing up here with a lot of lymph around it. Gotta get this bowel in shape. GI broom, lymphatic 1 capsule, stomach and bowel number whatever. This is your back here. This is your upper back, your C-spine. Here's your T-spine, and moving down into the L-spine. Then here's a little bladder, vaginal wall. I'm picking on you guys now. I think this is an after. I think they've already been working the program, but again, we have a big spastic condition here in the bowel. See how that looks like a V here? And that's just before, this is the transverse bowel, getting ready to head down. This is the splenic flexure. It's just a curve, and it heads down toward going out. So we got a lot of lymph going on there. That could be bronchial or heart, probably bronchial. Although it's right there at 3 o'clock where the heart should be. So that could be also a little genetic heart going. You know, when you have a weakness like that, clean your lymph system out. Put yourself on that heart formula. Look at those herbs I put in the heart formula, and they'll help you to see why I put them in there. Real strengthening of the heart muscle. Remember, you've got a nerve flow in the heart, so you got to strengthen the nervous system. That's the autonomic. You've got a blood flow in the heart. Well, you keep that clean by the fruits and the vegetables. And, of course, then you got a lymph flow, and that's the bad boy. Here's a lymph node swollen there in the chest wall. A lot of lymph in the hip area here on the left side and in the ovarian area on the left side. This is a knee, not a real happy knee on the left side here, and an adrenal that's just saturated with lymph. See all that white lymph around that adrenal? That's when you start seeing cysts growing on kidneys, cysts growing on adrenal glands, or tumors. Same thing. This is all set up. You got the setup for this, sweetheart, so you want to really move that lymph here pretty good.
Do you think you could stop it and take a break?
Well, here, ask me while we're doing this.
No, it's
Okay.
they're stopping.
Okay. Okay, well, let me just, hang on just 2 seconds. Let me just finish this up, and then we'll close this segment out.
Okay.
So just hold 2 seconds there, Brent. And we start moving around here. So getting those kidneys and adrenals, getting that lymph filtering is really key here. And it's funny because the adrenal gland turns on the kidney that filters. So this is a kind of a quandary here. Then you've got your rectal wall weakness right here. A lot of lymph in the vaginal area and lower back. See that lower back? Lots of lymph. So they're going to have sciatica and things like that in time. Here's upper neck and throat. See how much involved in throat? And parathyroid again. So this is a real important case to get parathyroid. Clean that sinus out, fix these spots in the brain, and you're in good shape. All right. So I want to thank you for tuning in. We're going to cut this. And then I'm going to come back and do some questions and answers for you here because I'm way behind on that. Take it easy on the eyes, please, because I'm having a hard time keeping up with your questions and answers. And I know some of you have some really important questions. Matter of fact, your questions are getting better and better and better. Can't say that I know everything here, so I hope that I can satisfy you and keep you well informed and tuned in. So go have some fun. I'll see you in about 10 minutes on a new video. Bye. Love you all.